Hello, my name is Laura Lee Mobley. I am a student with South University and I'm going to perform a full health physical assessment. This is for the course NSG 6020. We're going to begin by washing our hands or gelling them with alcohol. My patient is a 26-year-old Caucasian female. Her skin is warm, dry, and intact. She has pink, dry, intact skin with no visible cuts or lesions. We're going to go ahead by assessing her head, her scalp, her hair. Her hair is of even distribution. There are no bald spots. Her scalp has no cuts or lesions, and it is intact otherwise. I'm going to ask my patient to wrinkle your forehead. Go ahead and smile. Puff your cheeks and clench your teeth. Go ahead and with your teeth clenched, move them from side to side. And I'm going to go ahead and have you open your mouth and close it. I've palpated the TMJ and there is no crepitus. I'm going to go ahead and palpate the temporal artery, 1 by 1, plus 2, regular rate rhythm. And we're going to go ahead and palpate the sinuses under the eyes, cheekbones, under eyebrows. Any sensitivity? So sinuses are without any inflammation. And I'm going to go ahead and have a Snellen chart. My patient already said she was tested for her vision and she reports 20/20 vision. And we're going to go ahead and test for confrontation. So go ahead and put your right hand over your right eye and tell me when you see my fingers.
No. No.
Okay. And go ahead and put your left hand over your eye. Tell me when you see my fingers.
No. No. No.
Okay, you can take your hands off of your eyes. And we're going to go ahead and inspect the eyes, the conjunctiva. The sclera is white, the irises are green, and her eyes are round throughout. There are no popped capillaries or veins. We are going to go ahead and use our pen light to test for light reflex. Go ahead and look straight at the wall. Her pupils went from 4 to 2 on the right, and on the left from 4 to 2 as well. We're going to go ahead and do the 6 cardinal positions of gaze. What that means for you is you're going to follow my fingers wherever they go, okay? My patient was able to follow my fingers without any nystagmus. And we're going to go ahead and move to just you looking at this pen light. Her pupils were able to react appropriately and follow this pen light. We're going to look at the ears. With the ears, looking for symmetry on both ears. I'm going to tug at your ears. Any pain or sensitivity? No? Okay. I'm going to go ahead and look inside my patient's ears. Pulling up and back for adults. And I can see that her tympanic membrane was a pearly gray. And the other side, tugging, any sensitivity? No? Okay. We're going to go ahead and look at the tympanic membrane, and it is also a pearly gray. And we're going to go ahead and perform a quick whisper test. What that means is I'm going to move away and perform, or say a little word, and I want you to say what I said.
Dog. Cat.
My patient can hear. She has reported no problems with her hearing bilaterally. We're going to go ahead and move to her nose. Her nose is symmetrical. It is pink. It looks intact. My patient has not reported any problems with her nose. And we're going to look up her nose and look for a midline septum. Nose is pink throughout and her septum is midline. Can you go ahead and close the right side of your nose and take a deep breath, and then the left side. And both of her nares are patent on the right and the left. We're going to go ahead and move to the mouth and the throat. I'm going to inspect her mouth for any cavities, lesions, cuts, or bruises. Okay, and we'll look again with the pen light. Okay, the mucosal membrane is pink. There was no cavities or lesions noted. And we would obviously test for gag reflex by using any kind of device to check the back of her throat. Her uvula was midline as well. Go ahead and stick out your tongue and say ah,
Ah.
and move your tongue up and down. Okay, her tongue is midline, it is pink, and it was able to move appropriately to both sides. Her breath was non-malodorous, so there seems to be no sign of infection there. We're going to look at her neck. We're going to inspect for symmetry. Her neck color is the same as the rest of her skin, and her trachea is midline. We will also palpate the carotids one at a time. +2, regular rate rhythm, and we'll also palpate for her lymph nodes. Let me know if there's any pain or tenderness.
No.
Okay, and I did not palpate any palpable nodes. So we're going to go ahead and move to the trachea's midline, the range of motion of the neck. I need you to go ahead and move your head forward, back, left to right, and rotate. Any tenderness? So she has full range of motion of the neck. I'm going to ask you to shrug your shoulders against my hands, and she was able to do that bilaterally without any problems to her shoulders. And we're going to go ahead and move to the back of the patient. So I'm going to have her slightly turn, and I'm going to palpate posterior approach for her thyroid, and there are no palpable nodes present. Did you have any pain or tenderness?
No.
No? Okay. So for thorax and lungs, I would have my patient's shirt off and I would inspect her back and her skin. She reports that her skin has no cuts, open lesions, bruises noted. So we will go ahead and palpate for any lumps, masses, tenderness. Her spine is in alignment, and she has reported no scoliosis or kyphosis. So we're going to go ahead and listen, auscultate for breath sounds. Start at the left and listen to a full 30 seconds. Nice deep breaths. There were no adventitious lung sounds, and she was clear throughout from apex to base. So we're going to go ahead and move to percussing the CVA, the costovertebral angle, and it is to assess for any kind of tenderness of the kidneys. Any tenderness? Any tenderness? Okay, so we're going to go ahead and move to the front of the patient. Go ahead and sit forward again. Look at me. I would have the patient's shirt off again, and we would be inspecting for symmetry of the chest, of the breast, and of the sternum, and looking for any abnormalities on the skin. My patient reports no cuts, lesions, bruises, or any kind of pain on her skin anywhere. So I'll go ahead and listen to her lung sounds from the front. Starting at the left. So we've listened to bilateral breath sounds in 5 different levels, and she was clear from apex to base of lungs, no adventitious lung sounds. The next thing that we're going to do is auscultate the cardiac base with the stethoscope again. I'm going to have my patient lean forward, and I will listen at the mitral. And exhale. I did not hear any murmurs at this time, and my patient does not report any in her history. So we're going to do the upper extremities, and with this I want you to hold out your hands, okay? And she has symmetry throughout both arms, both hands. Her skin is pink, and she is normal body temperature and warm. Color is a pale pink, and her capillary refill is less than 2. Her nails are intact with no cracks. Now we're going to go ahead and look at her joints in her wrists. Go ahead and move your hands up and down. And we've already set tests for her skin temperature. So we're going to go ahead and palpate the radial pulses bilaterally, +2, and the brachial pulses, +2 as well. We're going to go ahead and move to range of motion of the shoulders. I would like for you to roll your shoulders forward and back, and go ahead and put your arms out, up and down. Any pain or tenderness? Nope. And shrug them forward and shrug them back. Any pain or tenderness? Nope. Okay. And go ahead with your wrists, roll them. Any pain or tenderness? Bend your hands forward and down. Okay, again, fine. And go ahead and squeeze my fingers and push up. Push down. Okay, so my patient is strong. Her grip is strong bilaterally. And we're going to have you lay down and get as comfortable as you can. We're going to inspect for a jugular vein. So go ahead and turn your head that way. I don't see any visible pulsations, and turn your head towards me. No visible pulsations. So we're going to go ahead and inspect. My patient's shirt would be off, inspect precordium, and we're going to palpate anterior chest. Let me know if you feel any pain.
No.
I don't feel any lumps, bumps, bruises. And we're going to go ahead and listen to the apical rate and rhythm at the apex of the heart for 15 seconds. Pulse was 78, and regular rate and rhythm as well, S1 and 2. So I'm going to listen with my diaphragm of the bell to the aortic, pulmonic, tricuspid, and mitral. Aortic at the second intercostal space on the right. Pulmonic at the second intercostal space on the left. Tricuspid at the fourth intercostal space on the left. And mitral valve on the fifth intercostal space. Can you lay to your left? And I'm going to listen with the bell for any other murmurs at the mitral. I wasn't able to hear any kind of murmurs at this point, and the patient denies any history thereof. We're going to go ahead and have you lay a little bit more flat. Okay, I'm inspecting for symmetry of the hips and the legs as well, and her hips look midline, and she has reported no pain or problems with her hips in the past. So we're also going to lift up your shirt and look at the belly button. Belly button is midline, and there is no open cuts or areas on the umbilicus as well. And there is no visible pulsations that I can see. And she has reported no pain in her abdomen either. So at this point, I'm going to take my stethoscope again and auscultate 4 regions for 30 seconds each time to listen for vowel sounds. The right lower quadrant, ileocecal valve. Right upper quadrant, left upper quadrant, and left lower quadrant. While I'm still here with the bell, I'll listen over the aorta for any bruits. No bruits. Vowel sounds were active in all 4 quadrants. No hyperactive, no absent vowel sounds. And I'm going to go ahead and percuss in 3 spots. Okay, and was there any pain or tenderness? I wasn't able to hear any high-pitched sounds or feel anything different. I'm going to go ahead and palpate. Any pain or tenderness?
No.
I wasn't able to feel liver border, spleen. Everything feels within normal range right now in the abdomen. So we're going to go ahead and move to these lower extremities. And she is symmetrical, skin is warm, dry, and intact, and she has no open cuts, lesions, or bruises. I'm going to assess for a range of motion of the leg and the hip, up and down, bend the knee, up and down, bend the knee, push up against, okay, and push up against, okay. So there's no problems with the muscles of the hips and the legs at this point. She is strong bilaterally and there was no pain noted. We're going to go ahead and have skin is warm, dry, and normal throughout. We'll go ahead and look at the lower extremities for any edema, which I do not note, and feel posterior tibialis and dorsalis pedis. And the toes, capillary refill lesson 2, go ahead and open up your toes, close them, flex them. Okay, perfect. And I'm going to have you use your heel and come from the top of your shin down. This test for cerebellar function, and do it with the other side. Okay, perfect. And I'm going to go ahead and have you lay there. I'm going to grab a sharp object here, and I'm going to strike it up your foot. Okay, she's negative for Babinski response. The next thing I'm going to go ahead and have you do is I'm going to have you sit up, and we're going to have you just dangle your legs. And again, she's symmetrical when she sits. It doesn't look like she has any abnormalities in her skin. I'm going to test for deep tendon reflexes of the knee. Locate the knee, the patella, nice and relax. And she does have a response bilaterally. And we're going to go ahead and do another little test here. I'm going to have something sharp and something soft. I'll have you close your eyes and tell me where I'm touching and if it's sharp or soft. Close your eyes.
Sharp. Sharp.
And where?
Thigh. Soft. Soft.
And where?
My forearm.
Okay. So she responds appropriately. And while you have your eyes closed, reach out your hand. And what do you feel?
Feels like a marker.
Yes, it's a marker. So you can go ahead and open your eyes. And she has responded appropriately to light and sharp pain in all her extremities. And she was able to perform a stereogenesis test appropriately. We're going to go ahead and do rapid alternating movements. What that means for you is I want you to grab your hands and flip them back and forth on your thighs as fast as possible. Okay? She was able to do that symmetrically and she responded appropriately. So neurologically, she is intact. The last thing we're going to have our patient do is stand up and walk heel to toe towards me and walk heel to toe backwards. Walk towards me on your tiptoes and walk backwards on your tiptoes. And go ahead now and bend forward as far as you can and stand up, twist at your hips, and do a shallow knee bend. Okay, you can go ahead and take a seat. This concludes your physical assessment. You are very well off right now, no problems that we need to assess further, and that is it for this time. Thank you.
Thank you.
You're welcome.